Hello, Dr. Greg here. Today's discussion is going to be on low back pain. We've heard it all before. It's all too common. Yes, it is. It affects 80% of the population. It is the biggest factor in work-related injuries, time off work, decreased productivity, limiting social interaction, sporting performance. The list just goes on and on and on. So what actually causes low back pain? Isn't it just a disc, a slipped disc? Everybody seems to have slipped a disc. Well, that's what I find when people present to my office, they really don't know what is happening. So let's go through and explain it in detail. There's 3 causes of low back pain. Lower back pain, yes, there is the disc. We'll touch that one in a moment. First of all, there's what we call sacroiliac related pain. Now the sacroiliac joint is where the ilium here joins the sacrum to form the sacroiliac joint. There's not much room for error in this very narrow joint. Now this is the main weight-bearing structure of the body. The weight should primarily come through these areas and be distributed throughout the legs. Now if that isn't the case, or this joint becomes restricted and isn't moving correctly, what results there is we end up with more pressure coming through this part of the spine, and that results in a more degenerative effect. Secondly, we've got what we call facets. These are the joints at the back of the vertebra here. There's 2 to each vertebra, and they are what stop the spine from over-rotating and the likes. Now these facets can wear themselves, and within that you can get chronic pain syndromes developing, very acute, very sharp pain, because there's a very rich nerve supply in around these areas here. So don't discard those 2 factors. Thirdly, we do have a disc. Now these are these things here, and you can see here, that's what they call a disc bulge. Everybody gets a low back injury and automatically assumes they have a disc bulge. Yes, they may, but that is just one cause. Now what happens with a disc injury is we start out with a healthy spine like this. When we end up with any sort of injury, any of those 3, we get a reduction in the amount of movement. Now in an acute phase like this, sometimes painkillers and a little bit of rest can help take a bit of pressure off. However, in the longer term, if this disc doesn't go back to sitting in the right position within the joint, and the joint itself is articulating properly, we gradually proceed down this path here, where we get a decrease in disc height, putting more pressure on these nerves through here. The disc starts to lose its shock absorbing capability, and that's when you start to experience pain. It can be intermittent, or it could be more constant. The pressure just continues to grow. Then eventually we get down here where we get to what we call degenerative joint disease, or arthritis of the spine, where we're getting changes in the joint margins here, putting an extreme amount of pressure here, cutting off that nerve supply which supplies the muscle, and the muscle is in constant spasm and discomfort. Now by this stage here, it's very, very difficult to control what is going on, but you need to get gentle movement in there to nourish that area and work with re-establishing a healthy joint complex there. And the last one, when no action is taken, this is what we call a surgical issue. This is when there's no real disc left at all. The disc is not shock absorbing and the vertebra is starting to fuse. Now in this case, that is usually when we consult a surgeon, and that is an issue that affects very limited amount of people until right at the end when they've absolutely ignored this problem. So I strongly encourage you not to delay ongoing low back pain. If it hasn't resolved in a couple of weeks, then it starts to become more of a serious issue. If it's been there for greater than 3 months, it's deemed chronic. Medication, prolonged rest are proven not to have any positive effect on chronic conditions and are very detrimental. It is about establishing correct joint movement in there, which is what chiropractic focuses on. We are the specialists in dealing with the spine. Anything that we cannot help, we will send you on to a neurologist if that is the path that you need to go. If you would like some further information or to go through each of these 3 areas in more detail, please contact my office and book an appointment with me personally, or click on the link below and my office staff will send you out a free report. Have a great day.